This video will go over post-operative instructions after shoulder replacement. We will arrange a visiting nurse and therapist for the first 1 to 2 weeks after surgery. This person will check your vital signs and assess your surgical site. They will also work on home exercises and swelling control. This provider can communicate any concerns to your care team. Your care team will go over a tailored pain management program with you at the preoperative visit. This will take into account any allergies, intolerances, or potential medication interactions. Staying ahead of the pain is paramount to achieving your rehabilitation goals, and our multimodal program is designed to be taken on a schedule. Further details about pain management after surgery are included in our separate online guide, which patients should review. There is also a video on pain management. Your incision will be closed with absorbable stitches and covered with a skin glue. There will be a dressing over the incision that can stay on for a full week until your postoperative appointment. Do not submerge your shoulder underwater for at least 3 weeks. Infections after shoulder replacement are rare but serious. Keep your incision covered with a dressing for at least 5 to 7 days after surgery. Avoid submerging the incision underwater for 3 weeks. Monitor your incision for any drainage and alert our office immediately if this occurs. Keep soiled clothing away from your incision and keep your hands clean at all times. Daily exercise is critical after shoulder replacement and helps activate the muscles around the joint and achieve range of motion. The therapist will arrange a program of home exercises that patients should do at least daily, with some exercises performed more frequently. There is a balancing act between working hard and overdoing it. Listen to your body and do not try to push through excessive pain. Outpatient therapy usually starts about a week after surgery. We have a set protocol that we can provide your therapist so they can follow our recommendations for how to progress while still protecting the tendon repair performed during the surgery. Consult with your care team about where you plan to attend outpatient therapy, as our office does recommend certain practices who are most familiar with our protocols and goals. Most patients will attend outpatient PT for 10 to 12 weeks after surgery to maximize range and strength. Since you will only be attending outpatient therapy 2 to 3 days a week, it is essential that you perform daily exercises on the other days. Full recovery from shoulder replacement can take up to 2 years as the healing process matures and patients continue to make gains in function. We highly recommend that our patients continue a maintenance exercise program that continues beyond the end of formal physical therapy. Shoulder replacement gives patients the platform to achieve their physical goals in returning to activities, but each individual must achieve those goals through persistence and effort. It is important to allow sufficient healing before returning to strenuous activity. In general, you should wait 12 to 16 weeks before engaging in strenuous exercise to avoid injury to the soft tissues around the shoulder replacement. The early focus should be on swelling control, range of motion, and muscle activation. Sports like golf, pickleball, tennis, softball, and weight training require that your shoulder is well healed, strong, and stable.